so exciting.
I know. Hi, my name's Katie, and this is my kind of critique on a therapy technique. I'm going to be working through a solution-focused based technique about kind of motivating a patient who's in an inpatient facility about maybe setting goals for discharge that don't just focus on medication management. So the scenario is, Casey is playing a 25-year-old patient who has been admitted into an inpatient facility voluntarily for depression. And so the scenario is that she's further along in her treatment, and so we're going to be talking about what's going to be different once she leaves and kind of finding a solution of what's going to keep her from the hospital and ways to work through her depressive symptoms. So we're going to start from there. Okay. Hi, Casey.
Hi.
Thank you for joining me today. How are you feeling today?
I'm feeling all right. Feeling pretty good after treatment. So,
yeah.
Yeah.
Mm-hmm. Are you excited about going home soon?
Yes, I'm
Okay.
excited. I'm excited to be around my family and friends just after this.
Mm-hmm. Yeah. Well, I wanted to, have some individual session or small individual session with you to kind of talk about next steps.
Mm-hmm.
I know in group sessions you kind of talked about how your goals were to do more medication management, stay on your medication. I just kind of want to talk to you a little bit more about that. Is that okay?
Mm-hmm.
Okay. Well, before we get started, talking about that, I kind of want to talk about, what brought you into our facility.
Yeah. So, I've been struggling with some depressive thoughts,
Mm-hmm.
things like that. So it was getting a little worse than it has been recently.
Mm-hmm.
So, I just wanted to get some help on that. Some structure is nice. So.
Okay. So who decided that it'd be best for you to come inpatient?
I did. So it was, I thought it was a good time just because I could feel myself kind of getting a little lower than I usually do. So I thought it was just a good time.
Okay. So you were noticing your mood's kind of changing, more, lower, maybe was your energy affected probably?
Mm-hmm.
And you said was there isolation too or some social issues going on?
Yeah.
Okay.
So I noticed that, I was just a little more stressed out with work, but overall I was just kind of avoiding my friends, kind of avoiding, family and things like that. I didn't really feel like talking or hanging out or just doing normal things that I do. So.
Yeah, that makes sense. And remind me, you've had depression for a while now, that diagnosis?
Mm-hmm.
Okay.
Yeah.
And it sounds like you've, from what you've said in group about you've been able to manage it a little bit. And so I'm wondering about a time that maybe you were able to feel those depressive symptoms coming on, but you were able to kind of like hold it at bay, kind of stop it.
Mm-hmm.
Were you able to do that at some point?
Yeah.
What were you doing?
So I had just switched colleges, and so I wasn't really familiar with the city, or I didn't, have a lot of friends that I knew, and so I noticed myself withdrawing just because I didn't really know anybody. I noticed, classwork slipping and things like that, so I thought it would be a good time to kind of see what's going on before it gets too bad.
So when you were feeling the depressive symptoms, so remind me again, so maybe were you sleeping a lot more, kind of withdrawing from others, that kind of thing, so you were able to feel it, you saw that it was coming on. What did you do at that point to kind of keep it from, getting out of control, ending in a negative way?
Right. So I think reaching out to family members and friends that I've known for a long time helps. They kind of provide a little, relief from what I was feeling, I guess.
Okay.
So.
And when you're not feeling depressed, when you feel, more up and more enthusiastic, what do you find yourself doing?
I like to hang out with friends and do things. I think I'm more active in terms of, being more responsive at work, maybe. And then, when I was a little younger, just in school, I was a little more attentive. I was on time for classes and things like that.
Okay. So. All right. So more easily able to concentrate. being around your friends more, that kind of thing. Well, I think that being able to notice those signs before it got too difficult for you is a strength. Would you agree with that?
Yeah, I think so.
Yeah, I think that it seems like you have a lot more of awareness about how you're feeling and what your body's doing. Would that be accurate?
Yeah. I think so.
Okay. So, tell me a little bit more about, you've been hospitalized in the past. And so is that what was going on at that time too, where it just got a little bit too much to handle?
Yeah. So it was right when I had transferred schools. I'd kind of, started to kind of dip down, and so I admitted myself when I was younger.
Well, I think that seeing 2 hospitalizations where you voluntarily admit yourself kind of shows that you have some insight into like your symptoms and how you're feeling. And so I think that, just hearing what you've talked about in group and talking about in this session, you seem to be pretty aware when your mood starts to kind of go down and it starts to affect you in a negative way. Would that be an accurate statement?
Yeah, I think so. I mean, I think I'm a little more in tune with it now, just being older, being a little more receptive. But I mean, I kind of just had a bad feeling. I just knew something was different about me.
Yeah.
So I thought it was kind of the right way to go.
Yeah.
Yep.
Well, I think that, going through something so difficult like that and being able to kind of make a really serious decision to bring yourself into the hospital to get help, that's pretty impressive, to say that and be like, okay, this is what I need. And I think a lot of times, I'm sure you've met some people in a group that in that situation, they weren't able to do that and they needed somebody else. And so I think seeing that is something that can maybe help us kind of figure out what's going to happen next for you. So when you last, went through the hospitalization, and how long ago was that the last time you went?
It was a little more than 5 years ago.
Okay.
Yeah.
So when you went to the hospital, and even when you left the hospital, what was the plan? What worked well for you?
I mean, I really didn't have too much of a plan. I was kind of just excited to get out. I started going to some of those like emotional support groups where they're anonymous, which is nice. I didn't know anybody, which is nice too. And so I did those for a while, but then after I graduated and I got a job, I was just too busy, and so I started to skip meetings. And not that I didn't want to go, but it was just a timing thing. So
yeah. Well, I think that that's valid to kind of acknowledge that sometimes life gets in the way and we have priorities, but I think, can you think of a time where maybe you put your mental health first before other obligations?
Yeah, I mean, with work, I actually have a relatively flexible schedule, so if there's a day where I just know I just need a day, sometimes I can take that. It's rather planned, so, if I'm kind of feeling off one week, I can kind of take a day and hopefully, kind of rejuvenate myself.
But you're able to kind of know when you need to take a day.
Yeah.
Okay.
I think so, yeah. Especially if it's kind of that nagging feeling over the course of a couple of days, it kind of starts to be obvious, and so having just an idea kind of
Sorry, I have a dog in here. Okay, yeah. So I just think that being able to know when you are feeling a certain way and you need to take a day for yourself, I think is another example of being able to kind of hold off some of the maybe more serious symptoms that would need more attention.
Right.
So kind of giving it a space. Okay. So did the emotion support groups. What part of that did you like about that? I know you said the anonymity, but was there other parts to that you liked?
Yeah, I think it was the structure of it all, because it's not like, I'm sitting in a group setting. I like having other people kind of be able to relate to my story. Because I have friends and family that I rely on, and they provide me support and things like that. But a lot of times it's they don't necessarily have that first-hand experience, and so it kind of makes me feel a little more normal, I guess.
Mm-hmm.
So it just kind of helps me feel a little more regulated in like what I'm doing.
Mm-hmm.
Yeah, I think it's the stability of it.
Yeah.
So.
Yeah, I think that, you know, just from the few minutes we've been talking, that, you know, you gravitate towards relationships that are going to be more understanding,
Mm-hmm.
and that can also, you're able to tell when your depression's taking over because of those relationships, or you're not maybe reaching out as much, but then it's also a way for you to kind of move through your depression is to have those relationships. Would that be correct?
Yeah.
Yeah.
That sounds
okay.
Sounds right.
So, you know, so you had the Emotions Anonymous group when you were last hospitalized. Were there anything else that you did, or was it?
Yeah, I mean, so I was still in college. I joined a couple groups just to kind of stay social. And I mean, that was most of it. It just kind of helped with the structure and things like that. So.
Yeah, okay. So, you know, I think, you know, the reason why I bring up past hospitalizations, and sometimes that can be difficult to hear about that, but, you know, one of the things you'd like to do is not want to come back into the hospital. And so, you know, I kind of want us to think about what could be different during this. You know, I know in group you talked about, you know, I'm going to send you my medication. I think that's really important. You got the, you know, levels to that. I think it's Prozac that you're taking right now. But, you know, what else is going to happen? And so I think that the support group, that group therapy seems beneficial to you. Would that be correct?
Yeah.
Okay.
I liked the group therapy. Also just finding hobbies that kind of take my mind off it that are constructive, I guess.
What do you like to do?
Crafting.
Okay.
Yeah. Sports and things like that.
Okay.
So.
Do you like to do that stuff by yourself, or do you go to, you know, so, you know, they have those, like, you know, paint things with friends or what?
I actually haven't done one of those. That sounds fun. But, like, I mean, in terms of, like, sports, of course, like, I've joined a team in the city, so that's fun. It keeps me social. And exercise is always good, too, so.
So do you think that social piece is something that we need to kind of build into your aftercare plan? Yeah,
I think so. I think it's a huge step. Just because I do notice that when I start to get down or when I'm not feeling like myself, I've noticed that I kind of withdraw from people. Even if it's, you know, not returning a phone call or you know, something like that. So.
And I know we kind of talked about this at the beginning of the session, but, you know, when you were going through those experiences, you know, you reached out to your family, and what was their response to you when you reached out to them?
They were supportive. Yeah. And I mean, kind of like I mentioned, it was, they're supportive, but it's not necessarily like a lot of firsthand knowledge, and so it's kind of like they're sympathetic, but they don't have the, like, empathetic kind of feel. So, you know, which is good in some aspects because I don't want anyone to feel like that, but it's it can still kind of feel a little lonely. Especially not having, you know, one of your close family members or friends, you know, being able to feel or know what you feel like. So, have you ever had a time where you felt comfortable talking to your family about what you needed from them? Yeah, eventually. Yeah? Yeah. You know, especially because I think they notice when I don't call back or don't hang out or something, it starts to be obvious. And so eventually it was just, you know, I think I just got comfortable enough to tell them. And I think it kind of helped because then they start to notice when I start to withdraw. Maybe, you know, they check in on me a little more often or something like that. So. Oh, wow. So you were able to kind of express what you needed from them, and they responded the way you wanted them to do. Yeah. For the most part. Given the circumstances, they don't understand everything. Right. Yeah, I think it was more of like, it was easier for me to just tell them what exactly would make it easier. Yeah. So. No, I think that shows that's a really great ability to problem solve.
I think that a lot of times with diagnoses like depression, people don't understand when they don't have it. And so sometimes we have to kind of tell them, this is what you need to do in this situation. And for a lot of people, it can be difficult, but it sounds like for you, when the timing was right, you were able to kind of take that step.
Yeah. I mean, my family and friends are pretty great, so they were very understanding. And at some point, it's obvious when you're so close with people, when you start withdrawing or kind of acting abnormal, it's more obvious than you would think it is, and so they kind of had an idea. So.
Yeah. So would you say that that's the biggest piece? That's the most noticeable, visible piece for your depression is the isolating and kind of withdrawing from friends and family?
I think so.
Okay.
I think one of the biggest ones, especially to my friends and family. I think in other aspects, I used to have issues with sleeping and not really having an appetite and things like that, which that might not be as obvious because, I don't live with my family, and so some things like that aren't as obvious as they may be, if I'm not calling or hanging out or something like that.
Right. But that might be the one that's when they start to notice. It may not, the sleeping and stuff might not be as noticeable. Yeah, that's a good point. So do you think that might be something we need to kind of put into your aftercare about maybe that socializing piece? Or do you think there's something else that is more important?
I mean, I think definitely the socialization. I think the other aspect would be, like I've been on the Prozac, and I think part of my problem is that I don't think it's like a high enough dosage or something like that. So maybe looking into that as well. Maybe it's kind of like a 2-in-1 type thing.
Yeah. No, I definitely think that you bring up a really good point, especially with, having a diagnosis like yours. Like, we need to keep up on the medication. And I think your insight on staying on your medication regimen is a really good one and really important because it's hard to participate in any kind of aftercare therapy when we're not on the medication that's going to help kind of stabilize that mood. I'm assuming your doctor has probably changed some of the medication since you've been in here, but as you probably know, that it does take a few days, and so we definitely need to make sure that's monitored when you leave. Yeah. So, definitely think socializing piece is really important. How do you feel about going back to some of those support groups?
I feel okay. It's more, I liked going. It was more of a convenience factor. Just timing and things, after getting off work, it's when I first started going, I was still a student, so it was easier to kind of maneuver my schedule. And so even though I have a kind of flexible schedule now, it's still kind of more difficult to, get there, especially since it's across town or something like that. So. Okay.
If we found something that was closer to you, would that be something you'd be interested in?
Definitely.
Okay. All right. So that's definitely one piece to that. So let me write that down. So the Emotions Anonymous is what you were liked, or were there more focused groups that you wanted? Or?
I think the one I went to was Emotions Anonymous.
Okay.
But if there are other ones that would, I guess, apply or make sense, I would be interested in them.
Okay, great. I like that you're able to assert yourself there. Because we don't want me to, tell you what you should do after care and stuff. So I definitely want to, maybe we can find some things for you and you can kind of choose what would be best for your, what you want to get out of that. Okay, so let's think about maybe 1 or 2 goals that we can probably have for you as you kind of start discharging in the next couple, or leaving the hospital in the next couple of days. I kind of want to focus on that socialization piece. What do you think?
Yeah, I think that's a good start, especially.
Yeah, so it sounded like, when you were having some depressive symptoms, you were kind of withdrawing from your family, not maybe being as active and initiating conversation, or not even just conversation, but going out with friends and stuff. Do you think that by being more social, that might help prevent some of the depressive symptoms you're experiencing?
Yeah, I think so. I think making more of an effort to reach out to my friends or family or whoever. I think it kind of helps, especially, keeping that conversation going or planning something. It kind of gives me something to look forward to. And I think it's also, part of the structure that I like, which is nice. So.
Okay. Yeah, I think that's a great idea. So goal number 1, we'll try and get at least 2 goals during this session.
Okay.
So goal number 1, maybe, what do you think? You said something about reaching out to friends and family. So what's a reasonable amount of events or, experiences that are going to fit into your schedule so it's not overwhelming for you in terms of juggling work and stuff, but it's still giving you that social piece?
I would say, we could do, maybe reaching out to a family member or a friend, maybe once a week or something, to, grab dinner or have lunch or something like that. Maybe once a week would be fine to start with. So,
do you have friends in mind that you think you'd feel comfortable reaching out to? Because I guess that's the other piece to this. It's just do you feel comfortable initiating? Has there been a time where you were able to initiate with somebody else and it went okay?
Yeah, usually, when I initiate, they're my good friends or family, so it's always received well. Yeah, I could, reach out to my partner or a couple of my best friends and see.
Okay.
Also family members too, so.
Okay, so family, partner, close friends. Okay. The reason why I ask that is just, sometimes, when the depressive symptoms start to happen, some of those negative thoughts start to kind of cloud our vision. And so I just wanted to make sure that, there was instances in your experience where you asked somebody for something and maybe it wasn't received well, or to make sure we're kind of avoiding those times where those thoughts could maybe creep in and kind of take over. Does that make sense?
Yeah. I think in those cases, it's one of those, where it's getting a little bad, and so reaching out to somebody, it's a little more daunting, maybe.
Yeah.
But it always ends up well, so it's okay. It's I think the initial reaction is kind of I don't want to do this, but I think it always ends up in a positive way. I hang out with somebody or just talking to somebody always helps. So.
Well, it sounds like the fact that you can say it ends up positively means that you kind of pushed through that fear a little bit and asked them anyway.
Yeah.
Good. Okay. So we have our Emotions Anonymous group, our medication, staying on medication, being with a psychiatrist, that kind of thing. And then reaching out, goal number 1 would be reaching out once a week to a family member, your partner, or close friends. Okay. All right. Can you think of maybe one more goal?
Maybe me being more involved in work events, social events. Sometimes at work we'll plan events, or we have events through different people that we work with, and so maybe being more involved in those would help. Not only for for myself and for social reasons, but for networking as well, just as someone that's in my business.
Yeah, I think that's a great idea. I think what you just said about having those social connections, but I think when we make choices that can further our accomplishments and our careers, I think that would contribute to some happy feelings about ourselves and maybe improve some self-confidence too. Okay. All right. Okay, so goal number 2, going to more work events. And I know we already talked about 2 goals, but maybe we can set a goal for the Emotions Anonymous group or the group you decide.
Okay.
What's a realistic amount of time do you think that you'd be able to dedicate to that?
Maybe at first we could do once a week, depending on what days they hold it. And then maybe we can push it to 2 times a month and kind of stretch it out so it's there, but it's not an overwhelming amount of times or something like that.
Yeah, I think you bring up a good point that we don't want to overwhelm you because that could burn you out on that stuff really easily. So I think being able to see your limits is a big strength for you. Or not even just your limits, but just like what's going to work for you. So yeah, it was once a week and then kind of phasing out. Maybe at that point you might decide that individual therapy is going to be the best for you if you want to continue that. And then do more of the social events with friends. I think that would be a good way to monitor it for sure. Okay. All right. Well, how comfortable do you feel with this discharge plan? I know we kind of switched it up a little bit so that you came in here thinking that just going to do medication. How do you feel about some of the goals in discharge planning that we created in this session?
Yeah, I mean, I feel pretty good. You know, I think it's obvious to me when I need to reach out to somebody or do something. So I think it'll be good. I think it'll be easy because I know what the result is, you know?
Yeah. So. Yeah, and I think that, you know, a lot of times when being in here, it's very easy to focus on all the stuff going wrong. But just in the, 25, 30 minutes we've been together, being able to focus on your strengths, noticing that social piece, how important that is to you. And your ability to kind of recognize, okay, my sleeping patterns, my eating patterns, that kind of thing, I think are 2 things that you were able to pick up on immediately, and I think will be able to help further on as you continue, working and managing that diagnosis. So, okay. Well, I just want to thank you for talking with me, and, I appreciate, you being willing to kind of think more about your discharge plan and kind of, like, stretch yourself a little bit. I think that was really good. So, thank you.
Of course. Thank you.